Well, hello again. It's Jason Renault with the Alternative Mobile Services Association and AMSA Talks, and today I'm with Jason Friesen, who's with Beacon Dispatch. Hey, Jason, how you doing?
I'm doing great, Jason. Pleasure to be here, and thanks so much for the opportunity.
Well, I've been wanting to talk to you since I met you at Crisis Con last year and get to know more about. You showed me a little bit about what Beacon Dispatch is, and I want to get a little bit more in depth in that and hear about the mobile crisis teams that you have assisted in building, developing a dispatch system. But could you start by telling us a little bit about what Beacon, it's a little bit different than other organizations, what Beacon Dispatch is?
Yeah, absolutely. For a little background, I'm a paramedic by training, based here in San Diego County, uh, where I worked as a paramedic for years, but was very much involved in working with EMS development in low and middle income countries. And one of the things that myself and my colleagues noticed while doing this was that uh, nobody really had a 911 system, like your traditional legacy 911 system, even though everybody was carrying phones in their pockets. So this was a little over 10 years ago, and came up with the idea that if we had a simple messaging system where we could send alerts to people who could help and they could get them via text message on whatever phone they had in their pocket, you could start to coordinate a response system.
Hmm.
And so our first programs were in places like Haiti, the Dominican Republic, Tanzania. But as the software continued to grow and gain sophistication and more features, we began to be approached by groups in the United States, specifically those in alternative response, like mental health crisis response, also domestic violence,
Hmm.
harm reduction, opioid overdoses. And it just made a lot of sense, right? That they needed a 911 style dispatching system, but they didn't need what 911 had, and they surely didn't have the money for it. So that's what Beacon does, right? It's a cloud-based dispatch platform that makes it easy for agencies to alert, coordinate, and track response teams using basic desktop computer and smartphones or tablets.
So you don't need, well, wait a second. I'm starting a new business. Haiti is not where I do my testing. How did you come to Haiti as the first one of your first test markets?
I lived there after the earthquake. So in 2010, right after the earthquake, I was sent on a disaster response team and was there for about 10 days and then ended up moving back later that year. And that was in the middle of the cholera outbreak. And so cholera kills quickly, very easy to treat, but if you can't get treatment quickly, then you die. And so the whole idea then was they didn't have a formal response system.
Hmm.
So if we had this simple messaging system to alert people with pickup trucks who could go pick people up and get them to the hospital quickly, you could probably save some lives. So that's where it all started, to be honest.
That's real paramedic attitude.
Right? Whatever you got to do to get them to the hospital.
Oof. Okay, so on with the pitch. You've now been doing this for mobile crisis teams, alternative response, as you say, domestic violence, overdose. What exactly is this thing? And we're not using any special technology here, just tools we can buy off the shelf.
That's exactly right. That's our whole philosophy is bring your own device. You don't need any special hardware or special communications system or infrastructure. Whatever you've got is going to be exactly what you need. So that's really the way it works is that there is a web application for dispatchers who are sitting in an office, a call center. They can see the map, they can see where all their teams are. They create alerts, send them out, and then when the teams get them on the phone, it walks them through a workflow, right? And this is kind of the universal emergency or crisis response workflow. It doesn't matter if you're responding to a car accident or a mental health crisis or, you know, a woman in childbirth, the same system or logistical steps have to be completed. And those are, can you go? Are you on your way? Did you get there?
Yeah.
Do you need more help? Are you transporting? Did you arrive at the destination? Are you finished? just over and over and over again. And so that's what Beacon does, is it walks people through the whole process. And that helps with dispatchers. So when you have multiple teams out doing different things at different times and they're at different stages of the response, you've got a systematic way to document what they're doing, to keep track, and to know better about resource allocation and who's available. And maybe you got someone on a low priority call and they need to go somewhere more high priority. It makes it very easy to manage and coordinate all your different resources.
Well, I'm thinking of that management perspective right now because you can hold like you can hold your cell phone and you know ask know where your staff are at any one time, right?
Exactly. Exactly.
You can be walking your dog and see where your people are.
We have a lot of managers who will say exactly that. That at any moment they can open up the mobile app or they can open up the web application and they can see what their teams are up to. Are they out on calls? What kind of calls are they on? Where in the response are they? And they can, even through the application, they can chat with them. They can send documents. They can request more information. It's very comprehensive in terms of what you need for proper response technology.
So could you walk me through and just show this to me for a minute? I'll get off the
Absolutely.
screen and if you can show us what this looks like.
Yeah, let me know if you can see my screen
Oh
here.
yeah.
Okay, great. So as I mentioned, Beacon has two components. On the right side, this is what the dispatchers are using through the web pages. So, you can see all of your map markers, and these are all customizable. You want to put down whatever you need to. So, over here, we have a crisis stabilization center. Let me see if I can make it a little bit bigger because I'm on a little laptop here. Crisis Stabilization Center. Over here, we have, a hospital. Here's a caution, right? Male has history of violence towards first responders. Be sure to advise that you are not law enforcement, fire, EMS. And that was actually taken from one of our partners who apparently mobile crisis went to this location. The individual was very hostile towards them, but once they said, no, we're not law enforcement, we're mobile crisis, he became very amicable. But this is also someone they visited multiple times. So they decided, we should put this on the map. And so whatever is on this map is also going to show up on the responder's mobile application. So you can see it there.
So that's
And
what we're seeing on the left-hand side of the screen.
yep,
That's the what you see on your phone. The
exactly.
right-hand side, we're seeing what the dispatcher sees on their laptop.
Exactly. So here you have map markers. So, you can put down here's a homeless encampment, right? You can put down paths. Maybe you need a detour or you need, an evacuation route or just the best way to get into a location. You can put those all down there. But then over here on the left, you can see all of your responders and different colors mean different things. Basically, green means they're available and any other color means that they're assigned to an incident. We have GPS, so if you click on their icon, you can see that's me on the helicopter. We've got the full suite of chat groups. We've got the all chat group. We've got incident chat groups. We've got individual chat groups. You can make your own custom groups, so maybe supervisors only or overnight shift only, right? And so that goes back and forth between dispatchers and responders. If you have a VoIP application, something like, well, Skype just got closed down, but something where you can make phone calls through your software or through your computer, then you can hook it up here. But then here you have all of the active incidents, right? And so, again, this is a demo count, so we're not really looking at anything real here. But these show you all the location of the incidents, who would be assigned to them, who's what state they're in. You can open it up and you can see who's assigned to it, all of the information that you need. If you need to update the location or the description, you get more information. It's all in there. But I'll show real quick, just for the sake of brevity here, how it would actually work. So let's say I'm in the call center and I get a phone call. Someone says, they give me an address of 2330 Soto Street here in San Diego. And they want to talk about someone having suicidal ideations. right? So send the mobile crisis team. Once you drop that pin, you actually might see this, which means that we've been there before, and it shows you the total, a whole incident history of every time you've been there. Same thing if you have the caller number. So let's say Mrs. Jones called this up. She gave us her phone number. You could also see, oh, Mrs. Jones has called us quite a few times, right? So you have that caller lookup as well. But we'll just say suicidal ideation, uh, PD on scene, requesting assistance, and safety is clear. And I'm going through this fast, so my spelling is probably not great. If we needed to, we could get the responder ETAs, so we could see, oh, the helicopter's only 7 minutes away. But we'll go back to Soto Street. Oh. So now we've got all that information in there. If we needed to get their exact location, maybe they're in the woods, maybe they're in a parking lot at Costco, or they're on the highway, you could send them a text message with a link in it. And if they click that link, it grabs their GPS coordinates and sends back to you, so you know exactly where they are. But we'll go categorize it, and this is all customizable. Everybody uses different schemes for how they classify their call lists. But we'll say it's suicidal ideation. We're going to call it immediate. There are different ways you can handle incidents. You can send it out immediately, or you can put it in a queue. You can schedule it. But then this is another real bonus for different users is there are different ways you can send these alerts out. So you could broadcast it to a group of people, right? And say, who can get there first? Or you could do the traditional way and say, oh, I'm going to assign one team and nobody else needs to hear about it. Or you could do both. You could assign a team, but let's say they're an hour and a half out, and there are maybe, for example, peer specialist volunteers in the area who could at least get there quickly and begin an assessment or an intervention while the team is en route. So there are different ways that you can alert people. Just for the sake of the demonstration, I'll assign myself. So we get all this information, then I click create, and there are loud noises going on. You can see here, I've automatically turned to red. That means I've been assigned to an immediate incident. It shows up here. And now on the mobile app, they get this alert. And like I said, it starts walking them through that workflow. So first they can see the location of the incident, and they can open this up. And since we've already been assigned to it, the first question it asks is, are you en route? And so we get in the vehicle, wheels are moving, and we say, we're on our way. And then Beacon says, let us know when you get on scene. If I need turn-by-turn instructions, I can click there, and I can get it through Apple Maps, Google Maps, Waze, or I could even do the turn-by-turn instructions through Beacon. When we get on scene, if we can't locate them, we could say unable to locate, and dispatch will get that alert. There's a feed over here, always updating them about what the teams are doing. And they could come and say, all right, we're going to give you more information. PD will wave you down on the street corner, right? Whatever it might be. And they can type this message or they can talk it. We have audio streaming too. So now that comes through and they can open it up and they can say, all right, copy that. We see them, whatever it is. But now they come back, they say they're on scene. Now it wants to know, do you need additional resources? Maybe they need another team. Maybe they're not the right team. They can always open up the sidebar. You can see all of the active incidents going on. You can see who's assigned. You can see who's available with the right permissions. You can see their location. Crisis Team 2 is fake, so they're not actually there. But you could send them a chat message. You give them a phone call. If you do need additional resources, you could assign them yourself. You could say, I want Crisis Team 2. Or you could send a message to dispatch, which is probably what dispatch would rather have you do. And they would say, okay, fine, we're going to give you Crisis Team 2. And so now they get assigned to the incident. They could send them a text message. They're on their way. You can see that they've been assigned here. So now that's taken care of. If we're going to transport, we would say, yep, we're transporting, and you'd have all your destinations preloaded. We're going to go to the San Diego Stabilization Center. We'll be there in 20 minutes, and we're taking one person with us. And you could set it up so that it actually sends a message to the destination saying, here comes, response team 90. They're en route with one patient, one client. Here's their phone number if you need to give them a call, right? They'll be there in 20 minutes. So you can do these kind of advanced notifications. When we get there, we say confirm. Uh, we go in, do our handover, give our turnover report, come out, we say complete, we're finished. And then it's going to give us a snapshot of, our response times. And then we could add a disposition code. We could add generic notes, or we also have, this is really interesting. Thanks to a grant from the McGovern Foundation, we were able to implement a customizable case report, which is basically build your own EHR, right? In EMS, they call it a patient care report. Fire departments call it a run report. Mobile crisis calls it an EHR. It's documentation. And everybody is basically collecting much of the same information, but they're doing it in different ways. So we made instead of saying, hey, use our EHR, we said, you can replicate yours in Beacon by building it out exactly field by field, how you would do it. And I can just show you real quick the default one we have, but it's actually really helpful because, like I said, you can build whatever you're using, you can build it in Beacon so that you could fill it out right there in the field. And this is, again, our default one, but you can imagine whatever your EHR looks like, if it were to appear here field by field replica in Beacon, that's going to make documentation really easy for everyone because then they don't have to be double documenting. They do it here and then they have to go back and do it in a computer, or they do it in the field on a carbon copy, right, sheet, and then they've got to go enter it back in the computer back at the office. This way, you can do it in the field, export it, upload it into your EHR one time. So that's all in here. And, signs and symptoms for EMS, all that stuff. But then for mobile crisis, they're going to be doing safety plans or risk assessments, right? Here in California, they have the MTAC tools. They have the crisis assessment. They've got the triage, the dispatch triage, and they've got the safety plan. So all of those can be uploaded in here and makes it very easy for documentation on the fly. So
So
that's it in a nutshell.
let me ask a question. Are you able to, would a user be able to export this information to, say, a spreadsheet somewhere so that they could do some data work?
Absolutely. You can download them, all the reports that we have. And we've got not just those case reports, but also incident reports, for all of the incident data with all of your response time intervals. We've got summary reports, so you could say, I want to see everything that happened last month, and you get it in the aggregate, right? But yeah, you can download those as PDFs, as Excels, or as CSVs. And in fact, we're working on new tools right now to actually give you a much bigger and more robust analytics dashboard so that you can start looking at this stuff straight through Beacon instead of having to download it in a Excel and re-upload it somewhere else. But
So you,
yes,
you mentioned
absolutely.
some integration with EHR. Is it particular products or can it work with any of them?
Uh, it's it's a great question. Anything is possible, right? But when you're talking about integrations, it takes two to tango. I mean,
Hmm.
we can export anything. We've got a robust API uh, that we import and export with already. But if you want to send it to your EHR, depending if you build your own EHR, like a lot of people do, then that makes life easy. But if you're using a commercial EHR, different folks are more willing than others to help you, though there are a lot of workarounds if they're not interested in collaborating. We'll say there are ways to get this data into that EHR, even if they're going to try and charge you $30,000 to do it, right?
It's sounding a little complicated, and as say I'm a clinical director, I don't know what any of these acronyms mean. So, do I need to get together with my IT people and sort out what I need before I call you?
If you want to do automated, right? Meaning Beacon automatically sends it to your EHR and your EHR just takes it and uploads it automatically, what we call a data dump. Then yes, the IT team needs to be involved. But if you just want to sit there and download the report from Beacon and then manually upload it into your EHR, you don't need to talk to anybody about that. You can do that yourself.
Fascinating, fascinating. Well, this is very interesting. Let's let me ask a couple more questions. You have helped some uh, teams get this dispatch system going, and you mentioned Centerstone and then in San Diego. Could you tell us about those?
Yeah, San Diego County was the first mobile crisis team that we worked with, and that was Telecare. It's actually a joint program, funded through the county, but
Right.
administered by Telecare and Exodus Recovery. Both of them are using Beacon. That was a really cool program to work with because when they started, they had about two teams doing 50 calls a month, and
And now
now
they've got like 40.
they're over 40 and they're doing over 1,000 incidents a month. And we've been with them from the start. So it's been really cool to see. And, we've grown alongside them. So that's been really rewarding. They've been a great source of feedback and how can we improve this to make it better for you. And in fact, just yesterday we were talking with them because Telecare has actually taken Beacon to multiple counties in California now. San Mateo, um, Stanislaus, and they're about to start in San Benito. So that's been great. Real for us, validation that it is working well for them, and they're glad to have it, and they've just been awesome partners, as well as Exodus Recovery. Centerstone in Tennessee,
Hmm.
um, really great partners as well. They started with the program in Tennessee, but now they're expanding to Florida, Illinois, and hopefully at some point Indiana. And it's interesting
Yeah.
there because they'll be running everything out of their Tennessee call center, but they'll be dispatching in multiple states. So
Oh,
Beacon's got a bunch of features that lets you divide, organize different programs within the same account. Another example is there's a very large city in Southern California that has uh, a a big problem with unhoused persons experiencing homelessness. And I'm not able to say at this point who exactly it is because I need sign off from the city comms department.
okay.
But this program is focused on unarmed crisis response for the homeless population. They've got multiple providers uh, across almost half of the city, and they are busy. And so the way it works is when the police get a call for something involved with a homeless person, they will, if there's no criminal component or medical complaint, they'll send it over to this program's dedicated call center. And then they send out their unarmed response teams to provide care, access to services, de-escalation. And it's a real benefit for everyone, right? Because it takes a lot of the burden off the police department, who doesn't have training in this, right, in providing care for persons experiencing homelessness. But it also makes sure that these calls are responded to rapidly. And so all the different organizations involved in this, it's a really excellent program, and I'll be excited to make a formal announcement about it once we get sign off from the comms department.
Now, I actually visited Centerstone, Florida a couple weeks ago, and it's a little town on the west coast of Florida, but it's right adjacent. The counties that it serves are not even rural; they're frontier counties. There's long roads where it's going nowhere. The geography must really make a big difference in your mapping and your resources availability. Is there any special accommodations you provide for that?
So because we built this platform, the prototype of Beacon was 2013, And when we were working in Haiti and the Dominican Republic at that time, nobody had smartphones. Everybody was still using
Okay.
phones. So originally, the entire messaging system was handled through SMS, right? SMS is kind of the cockroach of,
Yeah.
communication technologies. And so it still works with SMS. If you don't have good internet connectivity or you don't even have data coverage at all, as long as you've got a 3G or even 2G signal, you can send SMS. And so that at least helps with that workflow I just went through, right? Can you go? Are you on your way? Are you there? Etc. And all of that still happens through SMS. So that's a real benefit for rural communities with poor connectivity. Now, in some places we work, in Haiti, for example, oftentimes they don't have any signal. So they have Starlink. And actually, there's a rural county in California we're about to launch with that is very rural, and they've got a lot of dead spots, right? Just no mobile phone signal whatsoever. So what they're looking to do is to put Starlink in the car.
This is the Elon Musk venture with satellites around the planet.
Yep,
Hmm.
exactly. So that's exciting for us to see the innovation in that way too.
Last question. What's the future of dispatch here? What's cooking that we'll be seeing in 2 or 3 years?
Even sooner, in 6 months, we are working on a program with Integral Care in Austin, Texas, where they get incoming calls from multiple law enforcement agencies. And when I say multiple, I'm like 10, 15, and
Mm,
they're all sending them through email or web forms, and they all have different formatting, and they have, you know, it's a lot of different requests for assistance that if you were to
uh,
read them yourself, you would be able to put two and two together.
right.
But they don't have a 24/7 dispatcher. So what we're doing with them is setting up an AI interface so that when those emails come to Beacon, the AI or the text messages or the web forms, whatever it is, Beacon will be able to parse them, figure out what information is being sent, and then be able to create incidents and dispatch the teams automatically, automated using whatever was sent in that email.
Well,
So if
this,
there's a ton of information or if there's a little information, Beacon will be able to dispatch the appropriate team and help them get to where they need to go.
well, this is the sad part about crisis is that it's quite predictable. And so you're using prediction technology to sort of read these documents and say, okay, we understand this is a bonfire, in the school parking lot, and somebody's got to go over and deal with it.
Yep, exactly. So that's really exciting for us. We're also working on, I mentioned the custom case report builder.
Hmm.
Basically, we're going to take that, cut and paste it, and do it for intake, right? So dispatchers
Okay.
have scripts that they read,
Yep.
right? They go through these kind of forms. Everyone's asking for the same information in different ways and in different orders. So what we're going to do is make it possible that they can basically create their own script, put it in Beacon so that when the
Hmm.
dispatcher picks up the phone and starts taking information, they can read exactly what they want, what they need to ask right there on the screen and fill it out. So then it gets sent over to the responders.
Right. So this is sort of creating that intelligence test of pilots or surgeons, the checklist versus to try and remember all these details.
It's actually take happening, and it's been happening in 911. EMS uses something called Medical Priority Dispatch System, MPDS, and that has been developed over the past 30 years. But what it is if you say, I'm having chest pain,
Hmm.
these are the questions that need to be asked.
Right.
Or if you're saying, like, someone just passed out, these are the questions you need to ask. Or my wife is in labor, these are the questions you need to ask. So it's
Hmm.
like complaint-based scripts. And so we're going to build something so you can put in your own script. Either you use one, right? A lot of times mobile crisis, they just use the same script every call. But if you have different questions that need to be asked, depending on what information is given to you, it's going to walk you through that.
And from that, you can decide whether something can be dealt with by phone or needs to be dealt with in person and who needs to go and how
Exactly.
fast you need to go. Great, great.
Yeah.
Every
And
bit of help we can get, we need.
yeah, and the whole point is, again, not to put people in a box and say, this is how it needs to be done, but rather, how do you do it? Here are the tools for you to put it in this system so that you can start keeping it all in one software application.
Great to talk to you, Jason. It's very exciting.
I appreciate the opportunity. Great to talk to you. Love what you guys are doing and looking forward to the virtual conference coming up.
Okay, take care.